You are listening to Pulse, the Heart of Nursing, a podcast series on research at the Ellerslie Centre for Nursing Studies at the National University of Singapore. Advanced practice nurses, otherwise known as APNs, are catalysts to creating a high-quality healthcare ecosystem. Their specialised education, clinical expertise, advocacy in nursing leadership, and comprehensive approach to patient care are necessary to support the work in conjunction with other areas of healthcare to meet the myriad of patient needs. The development of APNs in Singapore has been rapid to meet the healthcare demand and support the local healthcare system. Today, we talk about how we can track the development of APNs and ensure patient safety and quality care. Here with us today is Dr. Tso Wen Tau, an Associate Professor and the Director of Education for Continuing Education and Training, CET, at the Ellerslie Centre for Nursing Studies at the National University of Singapore. She is also the Programme Director for the Master of Nursing programme here, which trains advanced practice nurses. Associate Professor Tso herself practices as an APN with a joint appointment at the National Neuroscience Institute, or NNI. Hi Wen Tau, it's so nice to have you in the studio with us today.
Thank you for inviting me, Joanne. It is my pleasure to be here.
Thanks, Professor Tso. So, I think today you'll be sharing with us, on how developing the advanced practice nurse is crucial to address modern healthcare complexities and, to sort of ensure that patient care is safe and of quality. Could you break it down for us a little bit? Tell us, what is an advanced practice nurse and what does he or she do?
Okay, the International Council of Nurses defines an advanced practice nurse as a nurse who has additional education, acquired the expert knowledge, complex decision-making skills, and clinical competencies for expanded nursing practice. The practice scopes of the advanced practice nurse are shaped by the credentialed practice context. They are trained in conducting health assessment, making diagnosis, and managing the common acute and chronic medical conditions. There are two types of APNs used internationally: clinical nurse specialist, CNS, and nurse practitioner, NP. In Singapore, we adopted a hybrid model where APN practice 80% of their time for nurse practitioner roles and 20% of their times for clinical nurse specialist roles.
Prof, so you mentioned that APNs are crucial for patient safety and quality care. How do APNs actually support this?
APNs work collaboratively with doctors and other healthcare professionals to provide complex patient care. They narrow the gaps in the clinical care practice and enhance team communication to ensure patient safety. Most importantly, APNs are able to anticipate the potential disease and treatment complications and deliver pre-anticipatory interventions and evidence-based treatments independently and collaboratively. APNs are very agile, flexible, fast react to the changes in the healthcare, and conscious about patient safety.
Advanced practice nurses really do play a vital role in offering their expertise to deliver clinical care that is not only safe but of quality. I remember being a new nurse in the intensive care unit and being just in awe of the way the advanced practice nurses there functioned. I was so amazed at their ability to not only anticipate complications and adapt to the complex situations in the patient care, but they also enhanced communication in the multidisciplinary team, and they were able to engage in the decision-making process. And I imagine that becoming an advanced practice nurse requires rigorous training and development. Prof Tso?
Developing advanced practice nurses in Singapore is instrumental in driving high-quality care. However, we need to better track, measure, and document how the APNs here are evolving so that we can better understand how their roles are developing and what can be done in future to hone their skills even better.
So what we're saying here is that we're interested in documenting how APNs grow and develop their skills over time. What do we know about this so far?
Okay, quite a bit has documented in journal publications. What I am interested in and focusing on is the Singapore story of our APNs here. Let me share the studies and publications on APN development that my colleagues and I have conducted over the past few years. These interconnected studies highlighted APN development and contributions in Singapore, often cited as a positive example at international conferences. Through these endeavors, we have here at NUS Nursing forged many collaborations for APN-related research, including partnerships with the International Council of Nurses, ICN, Canada, Finland, Australia, Ireland, Japan, and the USA.